Hi everybody, Jackie here with Dr. Dustin Timmerman from the Bilski Dental Group. How are you doing today?
Doing great, as always.
Wonderful. So we've been talking a lot about patient experience, and I want to talk about something that is really, really important. A lot of people are afraid of the dentist. So let's talk about why neglecting to go or neglecting to get something done that you know you need done on a tooth, maybe a filling or a crown or a root canal or something, and putting those things off, why neglect is expensive.
That's a great point. So I kind of want to beat that door down that it's dentistry, we say, is not expensive. It's not. Neglect is very expensive.
Yes.
And with that, if we have an educated patient, in my opinion, then we can avoid neglect.
Yeah.
See, I think I'll pride myself when my career is finished, I believe that I'm going to have the most educated patient base that's there. And that's what I think is the most important. Because I find that most of my patients are really actually wanting to learn.
Yeah.
And I think all of my patients are actually very intelligent people.
Yeah.
But if you don't have the information, how can you make an informed decision? It's almost impossible. You're just trusting some weird guy or girl that you just met that's inside your mouth that you can't see to come up with some decision. And maybe you're not in pain, but they're telling you need X. And then you're like, well, why do I need that? And then all of a sudden you become pain. And it's like, it's all it is lost in communication, right?
One of my favorite phrases in business is you don't know what you don't know.
That's exactly right.
And this applies here.
It applies probably to the most important aspect, meaning it can actually affect your health, right?
It can affect your health. So it's important to be educated.
Right.
For those people who do or don't want to learn, it's important to be educated.
Right.
So talk to me about how you educate your clients so that they don't fall in that neglect bucket.
Okay, that's great. So like, this is, I kind of, whenever I'm meeting a new patient or an existing patient, I always like to find out where they are with their education level and like what they're understanding. And of course, the amount of education I'm going to give you is basically determined on your needs. Most people don't know that a lot of the stuff that we have has just kind of been built like most medical procedures, just trial and error. So you can go every 6 months, and the reason you go every 6 months to the dentist to get a cleaning is mostly because your insurance company tells you that that's what you should do. And it was developed by a toothpaste company. It was just a marketing thing.
That's
exactly right. So when your dentist says, hey, you actually need to be in every 3 or 4 months, there's a truth to that.
There's a reason for that.
You develop X amount of calculus, your body's fighting it, you're not doing a great job at cleaning it, we need to see you this to prevent X, Y, Z.
The best thing for any patient to do is to talk to you, to get in, have a consultation, and more than a consultation, really a conversation.
Yep, you're 100% correct. One of that I know my staff is tired of probably me talking about, but for some reason, the general public, we just think that all teeth are equal. Like I've got how many can I get rid of before I care? And you know, I wish we all didn't have cheeks, because if we could expose how many people are missing teeth in the back, we wouldn't do it. Everybody's worried about the ones up front because it's part of their character, right? It's what we signify as beauty. It helps us, you know, like as long as we're good up front, we're good. But you didn't realize that we do all of these forces that need to happen in the back, have to happen in the back. If not, we push food forward and we start breaking teeth down in the front. So it is an education point where if I can tell you that tooth that you just lost is one of the most important in the mouth and we have to replace it. Or conversely, there's one that you are missing. I'm going to tell you that, you know what, your cheek, your tongue will grow back in that area. You don't have to have that tooth, believe it or not. There you go. I'm a dentist telling you don't have to have a tooth. But it's an education point.
It's an education point. And when you don't have those factors, you don't know the points, you don't know where the patient's starting from, you have to take it by what the circumstances. But
100%.
Once you do, and once you understand what the options are, you can work with the patient to help them decide. And at the end of the day, you're trying to avoid neglectful things that can cost them really expensive treatments in the future. You're trying to be preventative for their health, for their wallet, for whatever their pains and needs
You're 100% right. And I think that applies for almost maybe everything in life, but definitely your body and your oral care. If I can say one of the more dangerous things in life would be, or in dentistry, I should say, is cookie cutter dentistry. This where everything is equal the same. We're just going to do this, and this. If someone's not meeting you where you are, it's the jaw, the mouth, the tongue. Everybody is unique. And there's certain forces that you create that your mom doesn't, or your parents don't, or your significant other. So yes, it's 100% that we have to meet you where you are to develop the treatment plan that's going to get you to where you need to be in your oral goals.
Absolutely. So if you are out there looking for a dentist to take care of you, or if you are looking to switch dentists, if you are watching this and haven't been to the dentist in a while and are trying to get educated, the best way to get educated is to talk to a dentist, because they are going to meet you where they are at the Bilski Dental Group. So if you are working with someone who's who's not doing that, you need to talk to someone who's going to meet you where you are. Call them today, 216-524-4410, or visit them online at bilskidds.com. Neglect is expensive, and they're trying to help you have the best oral care, best oral health, and save you money. So don't hesitate to call them today. Thank you so much, Dr. Timmerman.
Thank you, Jay.